Okay, Breda, people who do a lot of travelling, like yourself, would be a lot more au fait about the issue of malaria. But a lot of people listening to us today are not very au fait with the issue. Could you remind us, first of all, what is malaria, and then tell us a bit about the work you do and concern on the issue?
Yeah, well, malaria is caused by a parasite transmitted through the bite of an infected female Anopheles mosquito. Most people don't like mosquitoes here or certainly in tropical countries, but there are 5 parasite species that cause malaria in humans. And it's quite life-threatening and still among the top 5 leading causes of death in Africa today, especially among young children. In fact, I've had malaria myself in Sudan, Vivax type, and very sadly a number of concerned staff and colleagues have died as a result of the most severe type of malaria called Plasmodium falciparum, or cerebral malaria, which now accounts, unfortunately, for over 99% of all malaria cases in the Africa region. So in terms of virulence, the type of malaria we have today is much worse and more life-threatening than what missionaries used to refer to in the past as building up immune systems to malaria. That is not possible with the falciparum type malaria. And concern has been obviously learning of and responding to malaria really since the beginning of the organisation in 1968, as we worked in Biafra in Nigeria and in Bangladesh in the early days, being a threat to staff, partner staff and our target populations alike. And today malaria is still found in over 20 countries in which Concerns is working. As we're not a medical organisation per se, our focus is on health promotion, education for malaria prevention, supporting and building local health systems and building community resilience against malaria, provision of mosquito nets, supporting early treatment referral to health centres, vector control through environmental health interventions, and within national indoor spraying programs in the countries in which we work.
I know you said you work on malaria in about 20 countries. Can you tell us a little bit about your work exactly? And I know there were floods recently in Malawi and Mozambique and Zimbabwe, weren't there?
Yeah, over the years in all our maternal, child and health programs, we would have responded to malaria. In fact, it was a primary intervention in Concern Rwanda's child survival program, which I was supporting in the early days, as it was the leading cause of mortality and morbidity among adults and children when the program was launched in year 2000. And thankfully, there was great improvement in the number of children less than 2 years who slept under a mosquito net, which was only 0.1% at the baseline. After 4 years, it had increased to 47% by the end line. And in phase 2 of the program with our partners, we introduced and supported home-based management of malaria, building up on community health volunteers to treat malaria as an expanded response to community health program management in all 6 districts where we were working. And later, the Rwanda government adopted home-based malaria management as national policy. In Niger, also in the child survival program, we worked on community case management with mother leaders, as they were called, mamas luminaires. And it's amazing, and notwithstanding that, local people, mothers, can be educated and trained to identify the signs and symptoms and provide oral treatment for malaria. Today in South Sudan, we're working with the Ministry of Health to roll out the community case management of malaria program. And in Burundi, with the population in Chibitoke province, we're also supporting integrated community case management. In Sierra Leone, a Concern has a program empowering communities to treat and prevent malaria. In Tonkalili district, with the district health team and the health facilities to build their capacities to respond to malaria. Because it does require efforts on all fronts, both health service providers and the population to help protect themselves. And like I said, Darren, with the recent floods from Cyclone Idai in Malawi, Mozambique and Zimbabwe, as the waters recede, this may pose a further threat of malaria for the survivors and affected populations. Flooding may initially flush out the mosquito breeding sites, but it often comes back when the water recedes, and the lag time is usually between 6 and 8 weeks. And in fact, the World Health Organization is already preparing for a spike in the coming weeks by procuring thousands of insecticide-treated bed nets to protect affected families in the high-risk areas. And Concern with our teams in Mozambique has recently purchased and distributed 2,000 mosquito nets as part of the non-food item kits to displaced communities in Sofala province. Likewise, our staff are protected by taking anti-malaria medication, using malaria skin repellents, and definitely by sleeping under mosquito nets. I mean, insecticide-treated nets are probably the best way to prevent malaria. If you don't get bitten, you don't get malaria.
Okay, and how is there a connection between floods and getting increased chance of getting malaria? Like,
mosquitoes like clean water breeding sites. So the more water that's stagnant in ponds, in lakes, in all wheels, in all vehicles, inundation as a result of floods, there is more space for mosquitoes to breed. And a lag time post-flooding, when waters recede, and usually people are wanting to start planting again, their crops, is often the worst time for their exposure to mosquito bites, which generally they bite between dawn, dusk, and after dark. And like I said, if you don't get bitten, you don't get malaria. So covering up is extremely important, whatever the temperature. And when I was living in Sudan, Cambodia, Mozambique, despite the warm temperature, I always wore long trousers or skirt, socks, shoes, hat and scarf. And it really is important to cover up, not wearing shorts, not wearing sandals. If you don't get bitten, you won't get malaria. And then for sleeping, like I said, mosquito insecticide protected nets are the best protection. And it's very hard to sleep with mosquitoes buzzing around your head anyway. So populations affected really do value mosquito nets that they receive in the non-food item kits to the displaced populations that Concern has provided in Mozambique and Malawi.
I know you were saying you got malaria once, and I was talking to Hans Omer a few years ago, the ex-head of DOCUS, and he was telling me he got it twice. I think it was in Chad. Most people who get malaria don't actually die from it, but a lot do. Is that true?
Yes. I mean, the good news is, like I said, that malaria is preventable and treatable. But anyone who develops a fever, headache, joint pains, shivering, when you're not expecting to get a cold or a flu in a hot climate, in a malaria zone, needs immediate testing. Don't wait. Early treatment is life-saving. And the latest data tells us that in 2017, there were staggeringly 219 million cases of malaria, up from 217 million in 2016. And still, in 2017, 435,000 people died from malaria. So it really is important to test and treat early. And that's our main message with community health workers in outreach work with communities, to test and treat early, especially for small children and pregnant women.
What's the likelihood of surviving if you get malaria and you have the medication? Is there much of a chance that you'll die, or if you have the medication, should you probably be all right? Or what's the story?
The treatment is very effective if given on time, early in the diagnosis, and with supporting fluids and foods and other factors. The issue is delay often. I mean, there is a concern with malaria resistance in parts of Southeast Asia, and we're now using a Chinese emanated drug called artesunate. But the main factor is time. Time is of the essence. So most people will recover if they're treated early. But like I said, prevention is better than treatment and cover up.
We'll come back to that in a few minutes, maybe. Am I right in saying that there has been huge progress in trying to end malaria in recent years and decades?
Yeah, the data is showing progress, definitely. In 2017, it was reported, because that's the data now being reported for this year. About half of all people at risk of malaria in Africa were sleeping under insecticide-treated nets, compared to only 29% in 2010. So we're about 50% global coverage in terms of mosquito net protection in high-risk areas in Africa. But unfortunately, that means that almost 50% of the population is still unprotected, and generally that's the poorest, most at-risk population. And the people we really need to think about are refugees, migrant or displaced populations, children, pregnant women, travellers, people living with HIV, or malnourished individuals whose immune systems are compromised. Often they won't have the mosquito nets with them, or they're living in areas where they're close to swamps or lakes, like the Rohingya population in Bangladesh, in very difficult conditions, swampy, marshy conditions, where the breeding sites for mosquitoes, are unfortunately very favourable. But the latest WHO report, just at the end of 2018, cautions that the sort of responses reach some stagnation, and the number of cases has remained the same in the period between 2015 to 2017. And complacency, can kill. And I am concerned about climate change with rising temperatures, which can result in new areas becoming breeding grounds for malaria if active surveillance and response is not undertaken. So it's a growing and expanding burden as climate change happens, and people are concerned that malaria may reappear in Europe again.
You were saying there that if you get malaria and you get medication for it, usually it does the job if you get it in time. So am I right in saying that, like with probably most issues, it's the provision of medication and the kind of availability of nurses and all, that's the biggest kind of challenge, is it?
Yes, community outreach workers and people who can support the testing, early treatment, and unfortunately in many of the countries where concern is working, the health systems have been affected by conflict and war in countries like Chad, Sierra Leone, Liberia. Sierra Leone also and Liberia post-Ebola. Democratic Republic of Congo currently with an ongoing Ebola response. Fragile health systems in some of the most fragile countries post-conflict do not have robust health systems able to early test and treat effectively people affected and infected with malaria. And this is a big issue. So concern is working in at-risk countries, like I say, in Burundi, currently going through some internal turmoil, to support increasingly community case management and home-based management of malaria, so that people are diagnosed based on symptoms of high fever, shivering or joint pains, headaches, and presumptive treatment is given in line with the Ministry of Health protocols. I mean, our key allies are the Ministry of Health in country and the local community health workers and the health facilities. These are the best based people to support prevention, education outreach, and readiness in terms of treatment response. And just seasonality as well around malaria in terms of rainy seasons. Often during the rains, the mosquitoes don't fly so much, they're breeding. It's post the rainy season when the mosquitoes are breeding, and after that the mosquitoes increase in numbers, and they're unfortunately flying around, particularly at dawn, at dusk, and during nighttime, to bite vulnerable people. And those most at risk are young children and especially pregnant women.
And when you say they bite people, like, do they do it like on purpose? Like, say for example, you compare mosquitoes to wasps in Ireland. Like, generally in Ireland or in Europe, a wasp won't bite you unless you kind of hit it or something. You know, is it the same with mosquitoes, or do they actually feed off human blood or anything like that?
Yes, some of the most virulent mosquito-carrying parasites prefer to attack humans. They will not feed off animal blood. They prefer to feed off humans. So it's a big threat for people in malaria endemic zones. And, you know, we still don't have a vaccine. There's no foolproof method to prevent malaria globally yet. It's not an easy task. A bit like the HIV response, you know, there are very many different types of malaria. But a vaccine has been in development over the past 3 decades. And they're going to now start a large-scale trial coordinated by the World Health Organization in Malawi, which is the first vaccine to provide some protection to children. But, you know, it still won't outweigh the importance of protection and prevention of mosquitoes biting children.
And are mosquitoes big compared to like wasps or bees in Ireland?
You haven't seen mosquitoes then, Darren, no?
Well, I have seen photographs of them, but the photographs of them are kind of like the picture of the mosquito is kind of increased, you know. So I don't actually know on a realistic, you know. Go on, yeah.
They're a bit like the size of a midget in Ireland. Like you can see some of the midgets. Yeah, some of them are quite big. And you can swat them. I mean, yeah, I've killed many of them. You know, if I find them in a room where I was staying when I was living overseas in Sudan, Cambodia, or Mozambique. So, yeah, you can definitely see them and hear them. The noise is infuriating if you're trying to sleep, buzzing all around.
So they're actually very small, yeah?
They're very small, but, I mean, they're definitely visible. Okay, and you can hear them before you see them.
Okay, yeah. I had the impression that they were bigger for some reason, but I didn't know they were very small.
They're like midgets in Ireland in if we get a very hot summer, you know, and they come out in the evening time.
Okay, Breda, could you tell me a bit about World Malaria Day 2019?
Yeah, the campaign this year, which is starting tomorrow, the theme of the campaign is Zero Malaria Starts With Me. The emphasis being on country ownership, like countries where concern is working, leading the response through the Ministries of Health, and community empowerment of people in their own communities to prevent and treat malaria. I mean, it's still unbelievable that there are over 1,100 malaria deaths globally every day from a disease that is technically preventable and very treatable if detected in time. I'm hoping through the World Malaria Campaign this year that the number of malaria cases can be reduced through accelerated investment and efforts in all malaria endemic countries by working more with local ministries of health, people and affected communities. We need communities on side. Like the Africa region disproportionately is still carrying the global malaria burden, home to 92% of malaria cases. And these are some of the poorest countries. And the African vector species is the main reason why 90% of the world's malaria cases are still in Africa. So, you know, concern is working, like I said, with the ministries, community health workers, local communities to support delivery on Sustainable Development Goal 3, Target 3.3 to end malaria by 2030. And with adequate resourcing, leadership, government engagement, community engagement, I think it can be achieved. But it needs a concerted effort. And the worry now is complacency with all the other competing infectious diseases. Ebola still going on in the DRC, Democratic Republic of Congo, where concern is responding again in terms of outreach and education for prevention. There are a lot of competing infectious diseases and non-infectious diseases. So unless health systems are strengthened in all countries to better detect, diagnose educate for prevention and treat malaria, I can't see the numbers going down fast immediately. It's up to us. And the Rollback Malaria Campaign, the Global Fund, are all affected by downturns in terms of the global economy and lack of investment in overseas development and health protection. I mean, it's in everybody's interest to protect global health in developing countries and in northern countries. And on occasions, people in Europe have died from malaria because they come back to a country in Europe. They forget to say maybe they were in an African country where malaria is endemic. It's not diagnosed on time, and people have unfortunately lost their lives. So we need to do education for all travellers as well as with people who are living in and affected in endemic areas.